Well, my patient has been prescribed metoclopramide 10 milligrams IV. It's an antiemetic medication to be given a half hour before meals to help with his nausea. The medication is diluted in a small amount of normal saline and given over 30 minutes. Since the meal tray will be coming in about 40 minutes, I'd like to get the antiemetic ready.
First, you need to check the medication order against the original order and check for allergies.
I've already verified the medication order with the original order according to hospital policy, and it's correct. Also, the patient does not have any allergies.
Good. And remember to observe the 3 checks and the rights of medication administration. It's also important for you to know about the medication before you administer it.
I already checked the drug guide, and the order dose is safe. The administration rate over 30 minutes is correct, and the patient has no contraindications. We'll just need to reassess to make sure the patient's nausea goes away after administration. But first, I have to gather the supplies and check the patient's MAR.
So let's confirm that the IV fluid and the medication are compatible, and we can infuse the medication as a piggyback intermittent infusion, meaning it's given through the existing IV over a short period of time. We usually do this with an IV infusion pump, which you can program to run at the appropriate rate.
Right, I remember that from class.
Okay, let's check the compatibility, prepare the medication, and then if everything checks out, administer it to your patient.
The medication and the solution are compatible.
All right, let's do hand hygiene then. Next, you're going to check the MAR. Choose the correct medication piggyback set from the patient's medication drawer for your first check, and check the expiration date.
Okay, looks good. Metoclopramide, 10 milligrams IV in 50 milliliters of normal saline, and expiration is valid.
Okay, now compare the label on the piggyback medication with the MAR using the rights of medication administration for your second check.
Okay, everything checks out. The right medication, metoclopramide, the right dose, 10 milligrams in 50 milliliters of normal saline, and the correct patient name is on the label prepared by the pharmacy.
Okay. Now, depending on facility policy, you may perform the third check of the medication label against the MAR now, but our policy is to perform the third check at the bedside, after identifying the patient and before administering the medication. Okay?
Okay, I'll make sure to do the third check at the bedside before administering the medication.
All right. Then lock the medication cart, and we're off to the patient.
Hi, Mr. Redding. Remember me from this morning?
I sure do.
This is my instructor, Miss Thomas. She's going to be observing for a little bit. Is that okay?
No problem.
Hi, Mr. Redding.
It's almost mealtime, and I have the medication to help with your nausea.
I appreciate it.
How is your nausea right now?
Bad enough that I couldn't think about eating anything.
Sorry to hear that. Well, this should help. Let me take a look at your ID band. Can you give me your name?
Like it says, Redding, George.
And your birth date?
That's easy. October 27th, 1948.
Great. Okay, I don't see any allergies in your chart. Do you have any allergies?
Nope, allergy free.
Good, okay. Now I'll scan the barcode on your armband and then perform the third check of the medication label by comparing the label to the MAR and scanning the barcode on the medication package. Metoclopramide, 10 milligrams IV in 50 milliliters of normal saline. It checks out correctly.
Good job, Erin.
Thank you. Okay, Mr. Redding, I'm going to look at your IV site for infiltration and inflammation. It's looking good. All right, and your primary IV fluids are infusing as ordered.
That's good.
Now, I've already checked the compatibility with the primary IV solution, but I want to make sure I have every step perfect, so speak up at any time.
Relax, Erin. You're doing just fine.
Okay. First, I'll close the clamp on the secondary infusion tubing. remove the cap on the port of the piggyback medication container and on the tubing spike.
Good. You don't want anything touching either end of the tubing.
Now I'll attach the infusion tubing to the piggyback container using a pushing and twisting motion, and while doing so, I'll be careful to avoid contaminating either end. There we go.
Nice job.
So now I hang the IV piggyback container on the pole like so, and I lower the primary infusion container with the hook. Okay, and the next step is to
Label the tubing with the appropriate date according to facility policy.
Yep. Okay. Now I'll squeeze the drip chamber on the tubing and release. It should fill up to the line about half full. And now I'm going to open the clamp and prime the tubing. I'm going to let the medication go all the way to the tip and then close it.
Perfect. Now use an alcohol swab to clean the medication administration port above the roller clamp on the primary tubing and connect the tubing. Open the clamp on the secondary tubing. And set the rate for the secondary infusion on the infusion pump. The 50 milliliters needs to be given over 30 minutes. Once the proper rate is set according to manufacturer direction for the secondary infusion, you can begin the infusion.
Okay, Mr. Redding, all set. It'll take about 30 minutes to finish.
Erin, you can go ahead and document the administration of the medicine.
Okay.
So be sure to document the medication, dose, route, which is the IV piggyback, the amount of fluid, the venous access site, the rate, and the time.
Okay, all documented. I'll be back after the medication finishes infusing, Mr. Redding. Just use the call button if you need anything.
Sure.
And breakfast should be here around then as well.
Oh, good. I'm looking forward to it.
Good.